I would like to advise the public of Barbados that of the 248 tests conducted by the Best DeSantis Public Health Laboratory yesterday, we had 12 positive cases. I stress, all remain asymptomatic, meaning they do not have any symptoms at all. 9 of those persons are from Ghana. Those are the nurses who arrived on Thursday. The other 86 of the 96, or the other 86 persons who came from Ghana, all tested negative. It should be noted that all nurses went into 14 days quarantine on arrival. In addition, we are increasing our monitoring and surveillance at designated facilities. This was always understood to be a necessary precaution. The other 3 cases are: 1, a Barbadian female who returned to the island on June 29th. 2, a male visitor who arrived on July 30th. And 3, a Barbadian man who arrived from the United Kingdom with a negative test, but who, when required to test to travel again, returned a positive test result. We are still investigating the circumstances of the last case. This will require extensive contact tracing, which the population is so aware that the public health teams do on a daily basis. As indicated earlier, all these persons are asymptomatic without any symptoms. Indeed, it is significant that only 1 person had a cutoff level in the results, which suggests that person may be in the acute phase of infection. The remaining persons are likely to be in the recovery phase. Let me reiterate that all persons who tested positive are immediately placed in isolation at Harrison's Point as per the protocols of Barbados. Let me reiterate, this has proved that our public health protocols are working, allowing us to detect positive cases at our ports of entry and before arriving passengers are allowed to mix with the general population. From the beginning, the Ministry of Health and Wellness has made it clear that testing of all arriving passengers for COVID-19 was a necessary precondition for reopening our borders to international travel and resuming regular air services. I am satisfied that the protocols which dictate that travelers either arrive with a valid PCR negative test already in hand or are being submitted to be testing on arrival is helping us mitigate the risk of transmission during air travel and reducing the risk of importation within our small island. And the rationale of the second test at day 7 for high-risk passengers is because we do recognize that there's a risk of exposure in the 72-hour period, which we have asked persons to get the test before they come to Barbados. Hence, on day 7, persons before they leave quarantine and indeed high risk must have a second test to be released out of quarantine. And if they refuse, they will be kept in quarantine for another 7 days, making it totally 14 days. This is in keeping with the international thinking on quarantine. We are issuing a new refined protocol to make it absolutely clear to persons before they come to Barbados what is required. The Ministry of Health and Wellness is committed to ensuring the safety of all residents of Barbados as we continue to deal with the challenge of this global pandemic. and we will do all in our power to contain the spread of the viral illness within Ireland. Many of you have heard the Prime Minister state repeatedly that when managing complex situations, we do not get to choose the circumstances we face, but we are obligated to deal with them. Today is just another one of those days. At the same time, I'm happy to report 2 more people will leave the isolation facility at Harrison's Point today after recovering from COVID-19. Recall that persons leaving the isolation facility will have 2 consecutive negative tests. This brings the total number of persons who have recovered to 98, while 17 persons remain in isolation. The Best DeSantis laboratory should be complimented, for in the short space of 5 months, we have been able to do over 11,500 tests on persons coming into Barbados, Barbadian citizens with any respiratory symptoms, and persons who need further investigation.